We've been saying for years that Plan G really is the superior Medigap plan. But with Plan F being slowly phased out, is Plan G the replacement? As always, if you have any questions, you can reach us in the comments below. And of course, you can give us a call at the number on the screen. We are licensed health insurance brokers, and we are more than happy to help answer any and all of your Medicare or health insurance related questions. And of course, if you want to stay up to date, make sure to subscribe. That way you do, in fact, stay up to date because we release these videos on a weekly basis. And please make sure to give this video a like. Click that thumbs up button so we can get this information out there. So first and foremost, what are Medicare supplement plans? Well, Medicare supplement plans are also known as Medigap plans, and they fill in those financial gaps of original Medicare. So you can think of them as the all-inclusive approach to health insurance. Basically, they're going to help fill in the deductibles and copays and coinsurance that you might have with original Medicare, and they can even impose an out-of-pocket maximum. So original Medicare will cover your hospital needs as well as most of your medical needs. And you'll have to pay a premium, usually at least for Part B, to keep this coverage active on a monthly basis. But when you actually go to use your benefits, you'll have a deductible to meet and copays and coinsurance. Now this is in lieu of paying the actual full cost of the services. But what are these costs? First, let's talk about Medicare Part A, which is your hospital insurance. Now, usually there's no premium for Medicare Part A, but there are deductibles and copays and coinsurance. And then there's Medicare Part B, which will cover pretty much everything else. Now, there is a premium for Medicare Part B, and it's based on your income. In 2023, the base Medicare Part B premium is $164.90. But it can go up from there, again, based on your income. And then there are deductibles and copays and coinsurance. So without some type of Medicare supplement plan, when you go to utilize your coverage, you would be responsible for these costs. Remember, Medicare supplement plans don't offer additional benefits that aren't already offered by Medicare, so they're not going to offer you dental, vision, hearing, or prescription drug, but they will fill in those financial gaps. So there are 10 different plans with varying levels of coverage. Now, although Medicare supplement plans are offered by private carriers, if your doctor or hospital accepts original Medicare, they accept your supplement plan regardless of who the carrier is. So make sure to choose a carrier that has a history of low and stable rate increases. So now let's take a look specifically at Plan F and Plan G.
So this page is on Medicare.gov, and it will compare all the different Medigap plans. Today we're really just going to be talking about Plan F and Plan G. So if you notice here, these plans are both asterisked, and that's because they both offer a high deductible version as well. So Plan F and Plan G will both cover your Part A coinsurance, which can certainly come in handy because if you need to be hospitalized for more than 60 days, the coinsurance can be quite expensive. Plan F and Plan G will also cover all of your Part B coinsurance or copays. It will cover your first 3 pints of blood if you need a transfusion. It will cover Part A hospice care coinsurance or copays. It will cover skilled nursing facility care coinsurance. Again, that is very, very important because if you need to stay past a certain amount of time, the coinsurance is per day and it can be pretty expensive. Both plans will cover your Part A deductible, and remember that is applied per benefit period, not per year. So if you need to be hospitalized more than one time in a given year, then you might need to meet that Part A deductible more than once in a given year, and that can definitely stack up. Now here is the only real notable difference between Plan F and Plan G, and that is that Plan F covers your Part B deductible, and Plan G does not. Now, unlike Part A, the Part B deductible is once annual. It is once per year. So once you've met that, then you don't have to worry about it until the next calendar year. So in 2023, the Part B deductible is $226. That's it. So when we get to later in the video, when we talk about comparing costs, you'll see why really, even though Plan F technically covers everything, we would still almost always recommend Plan G. We continue going down. Plan F and Plan G will both cover Part B excess charges. So basically, if your doctor accepts original Medicare, then they accept your supplement plan and they accept the amount that Medicare is willing to pay for a given service. However, Some doctors can choose to charge up to 15% more. And if your Medicare supplement plan does not cover that, then you would be on the hook for that remaining 15%. Those are what's known as the Part B excess charges. So the only plans that do cover the Part B excess charges are Plan F and Plan G. Plan F and Plan G are the same in that they will both cover up to 80% of foreign travel. And there is no out-of-pocket maximum or out-of-pocket limit because basically Plan F and Plan G are covering all of your remaining out-of-pocket costs. So basically, with the exception of that Part B deductible, they're covering your deductibles and all of your coinsurance or copays. So if you pay your monthly premium for Plan F or Plan G, there really is no additional cost to you, except, as I mentioned, the Part B deductible for Plan G.
So you can see just how similar Plan F and Plan G are, but there is a major difference: the cost.
So first and foremost, I would like to mention that the plans for prices are determined by a series of factors, one of the most important of which is your geographical location. So right now we're looking at prices for plans in Florida, and you may see different prices dependent upon where you live. Now, Medicare.gov will also ask you some information such as your age, your sex, and whether or not you use tobacco. So I'm not going to put that information in just yet, and you're going to see the broad range of prices. So let's scroll down to Plan F and Plan G. So this is Plan F, the high deductible Plan F, which I mentioned earlier, Plan G, and the high deductible Plan G. We're just going to focus on the regular Plan F and Plan G. So right now you can see that the premiums range between $254 to $2,180, and that is a pretty broad range, and that's because we didn't answer those questions above. Now let's scroll down to look at Plan G. And you can see that it would range between $222 to $1,781. Now let's scroll back up and answer some of these questions so we can get a narrower range. So let's put that we are 65, a female who doesn't use tobacco. We're going to update the prices, and you're going to see how that changes. This is a much narrower price range. Now we're looking at somewhere between $254 to $431 for Plan F, and $222 to $359 for Plan G. Now again, remember, these plans are almost exactly the same, with the exception of that Part B deductible. Now the Part B deductible in 2023 is $226. So if you divide that by 12 months, you're looking at about $18 per month. If you can get a Plan G plan for more than $18, less than what you would get a Plan F plan for, you're going to end up saving money. Now, here's the tricky thing. These are still pretty broad ranges, in all honesty. You know, it's a difference between $100 or $200 per month on these plans. So if you do decide that you want to go with Plan G, or you do decide that you want to go with Plan F, what happens is if you were to click View Policies, you then can compare all of the different plans offered by the different carriers to give you a better idea. But still in all, if you have to undergo medical underwriting, then these prices could change. So you can, of course, compare all of the different plans and prices on Medicare.gov, but it may be a couple of extra steps and hoops that you have to jump through, which is why we recommend working with a broker, because they can give you a snapshot of everything at once without you having to compare each and every plan and carrier yourself.
Now, Plan F is, of course, no longer being offered to new enrollees. It's being slowly phased out. So if you're someone who is new to Medicare and you're looking for the most comprehensive plan available, then your best bet would be Medicare Supplement Plan G. However, if you are already enrolled in Plan F, we would still urge you to possibly consider Plan G, because chances are you're going to save a significant amount of money. Yes, you'll have to pay that Part B deductible, but you'll save a lot on your monthly premiums. Also, I would like to mention there is no specific enrollment period for Medicare supplement plans, so you can actually enroll at any time during the year. So if you are interested in a Medicare supplement plan, please don't let the grass grow under your feet. Make an appointment with a trusted broker today. With that being said, although yes, you can enroll year-round, you're best suited to do so when you first become eligible. So this would be the 6-month window after you turn 65 and enroll in Medicare Part B. During this 6-month time period, you will not be subject to medical underwriting. After this time window, you may be subject to medical underwriting, which means you could be charged more or possibly even denied outright. If you have any questions whatsoever about Medicare or health insurance in general, please feel free to reach us in the comments below, and of course you can give us a call at the number on the screen. We are licensed nationwide and there is absolutely no charge for our services. But before you go, make sure to subscribe to stay up to date, and of course give us a thumbs up, click that like button so we can get this information out there. As always, thank you so much for watching. Bye-bye.